Welcome to the health sphere. And today we're going to talk about how celebrities are using Ozempic. So stick around. If you've been on social media recently, you probably heard of Ozempic or saw pictures of people injecting Ozempic or Wegovy and holding up their behinds to show off the results they have gotten from these injections. And it is creating a lot of confusion in the medical community and also among patients because people have very different understanding of what Ozempic is being used for. So I want to set the record straight and tell you exactly how celebrities are using Ozempic, if it really works the way people are claiming that it does, and whether you should be concerned about your own health when you see these types of pictures online. So let's jump right into it. So first of all, Ozempic is a medication that was originally approved by the FDA to treat type 2 diabetes. But recently, there has been a lot of buzz around another indication for this medication, which is weight loss. There is another medication, Wegovy, which is the same medication in the same class but at a higher dose, and that was recently approved for chronic weight management. And so when people are referring to Ozempic as a weight loss drug, some of them may actually mean Wegovy. But for the purposes of this video, I'm going to consider both medications together since the effects are very similar. Semaglutide, which is the active ingredient in both Ozempic and Wegovy, is part of a class of medications called GLP-1 receptor agonists. You may have heard that before. Basically, what these medications do is stimulate certain receptors in our body that help regulate appetite and fullness. When those receptors are stimulated, they send signals to the brain that tell us we're full and satisfied, which leads to less hunger and ultimately weight loss. So these medications work by suppressing appetite and increasing fullness. They also slow gastric emptying, which is how long it takes for food to leave your stomach, by slowing down the time that it takes for food to leave your stomach. You feel fuller for longer. And these medications also increase insulin production when blood sugar is high and decrease insulin production when blood sugar is low. So they help with blood sugar control as well. In clinical trials, people who took semaglutide lost between 3 and 15% of their initial body weight over the course of a year. That's pretty significant. Weight loss just from taking an injectable medication once a week. And in addition to losing weight, many people had improvements in things like cholesterol, blood pressure, blood sugar, all markers of metabolic health. These medications have been shown to improve or reverse things like fatty liver disease and even reduce the risk of major cardiovascular events like heart attacks and strokes. So not only do they help people lose weight, but they also greatly improve their health. The way people have been using Ozempic off-label for non-diabetic, non-weight-related indications is mainly for cosmetic purposes, like to get rid of belly fat and love handles, also to contour the face and jawline, basically to get a slimmer, more sculpted appearance. Now, while the FDA hasn't approved the use of semaglutide for this purpose, the celebrity endorsement and the TikTok videos have led many people to try it out and seek it out for cosmetic reasons. So there are a lot of doctors now offering Ozempic and Wegovy off-label for these types of cosmetic uses. Now, one thing you need to know is that the doses that people are using for cosmetic purposes are higher than the doses that are recommended for diabetic or weight loss purposes. For example, the typical dose of semaglutide for type 2 diabetes is between 0.25 and 1 milligram once a week, whereas the doses that are being used off-label for cosmetic purposes are typically between 1 to 2 milligrams per week. Now, as far as the safety of using these medications off-label for cosmetic purposes, there haven't been any studies done specifically on this use case, so it's really hard to say whether it's safe or effective. However, the side effects associated with the higher doses of semaglutide have been studied. Now, the side effects that people experience most commonly are nausea, vomiting, diarrhea, abdominal pain, and fatigue. Now, those symptoms tend to happen within the first few weeks of starting the medication, and they tend to go away after a few weeks. But if you continue to take the medication, the risk of other side effects goes up, including an increased risk of pancreatitis, gallbladder issues, and kidney problems. Now, semaglutide is also in a class of medications that has been known to cause thyroid cancer in animal studies. Now, the risk of thyroid cancer in humans is not clear at this point, but it's something that people are looking into. Also, there is no data on the use of these medications during pregnancy or breastfeeding. And finally, it is important to note that semaglutide is not a weight loss drug and it shouldn't be used as a substitute for diet and exercise. So here's what you need to know. If you see somebody's picture on social media and they are holding up their behind and they are injecting something into their gluteus maximus muscle, they're probably injecting filler. It's not Ozempic or Wegovy. That is definitely not a place you want to inject these medications. It is very likely that the person you are seeing on social media is not injecting Ozempic or Wegovy at all. Most likely they are injecting some type of dermal filler into their buttocks to give the illusion of having less fat there. Some people also inject filler into the back of their arms or other parts of their body to make themselves look thinner. Now, if you do have concerns about excess fat in your body, talk to your doctor about whether removing some of that fat would be good for your health. but the bottom line is, if you're seeing these pictures on social media, don't get too caught up in it. A lot of times these pictures are misleading and they do and represent what people's bodies actually look like. Also remember that everybody's body is different, so what works for one person may not work for you. That said, if you do have concerns about your weight and you're worried about your health, talk to your doctor about whether Semaglutide is right for you. Semaglutide can be very effective for helping people lose weight and improve their metabolic health. But it's important to use it under the guidance of a healthcare professional. Don't try to buy it off AliExpress. Don't try to buy it from some shady website, only buy it from a reputable pharmacy, and don't take more than the recommended dose. And I hope this video was helpful. I know there's a lot of confusion surrounding the use of semaglutide and Ozempic, especially because it's being used off-label for so many different things. It's really hard to keep track of what's going on, but hopefully I was able to shed some light on this for you. If you enjoyed this video, please give it a thumbs up and subscribe to my channel for more content like this. I release new videos every Monday and Friday, and if you have any questions, leave them in the comment section below. I do read all the comments and I try to respond to as many of them as I can. And if you'd like to learn more about semaglutide, I'll link some research studies in the description below. Thanks so much for watching. I'll see you next time. Bye.